Hey friends, good morning and good afternoon. My name is Jeff Miller from ERPA. Thank you for setting aside 45 minutes to join our discussion today on the topic of open enrollment. ERPA supports customers throughout their entire life cycle on Workday. Our model benefits both existing and new Workday customers with implementation services, application support, private to public cloud migration, and much more. But today is all about open enrollment. Couple of housekeeping matters before we get started. First of all of your microphones have been muted for the session. The chat is going to be available for you to engage with us, and I'll be monitoring the chat for any questions that you type in, and we're hoping to have some time at the end where I can pitch those questions to our presenters today. Links to the recording will be sent to you. You always ask this. It's one of the most popular chat questions. Yes, you will receive the recording. You will receive the slide deck. Give us a few business days to get all of that prepared, and we'll send you an email with convenient links for you to access those files. Near the end of our time today, I'll be dropping a link for you to register for our next big webinar coming up. Hundreds of you have found this helpful in the past. It's all about Workday's upcoming release. And we would love for you to register for that next webinar today, even before you leave this event today. And then finally, following today's discussion, there's going to be a very brief 4-question survey that's going to hit your inbox, including a question about Workday Rising. So we definitely want you to weigh in on that survey and give us your answer to our Workday Rising question. We'd be grateful if you would take 30 to 45 seconds to answer those brief 4 questions. Next is our table of contents, or our agenda slide. Lots of great content coming your way. And as you browse this table of contents, please know that our goal today is to show you helpful information provided by Workday on Community for typical configuration and required updates, as well as provide some key areas where possible change would increase the level of effort or risk with the process. We have some wonderful tips and tricks along the way for planning and testing that we're going to sprinkle in as well. And then our intro, our 2 seasoned experts, our presenters today. What's in store for you today is a great discussion by these 2, ERPA's own Natalie Keith and Beth Granazio. And I'm going to invite them, Natalie, beginning with you, if you would unmute yourself. And Natalie, tell us a little bit about yourself, please.
Hello, I'm Natalie Keith. I am located in Missouri. I have been in the Workday ecosystem about 5 years. I started on the customer side, I moved to implementation, and now I am working on the post-production side. And so the next topic of the year that we always love is open enrollment, and just cross-functional experience with that I have had on both the customer side and the implementation side, and now in the post-production. So very excited to talk to you all today about that. And then I will turn it over to Beth.
Hi, everybody. My name's Beth Granazio. I'm located in coastal Virginia, near the Virginia Beach area. I'm a functional architect here at ERPA. I'm certified in HCM, benefits, people experience, and talent performance. Been in the ecosystem for about 10 years, but first met Workday on the client side and was part of the Workday implementation as a benefit analyst. So I've sat in your chairs in the past. I've moved over to consulting. I've had to do testing and troubleshooting for payroll and integrations as well, and just super excited to share our experience with you all.
So first up, we're going to talk about Workday Community and the resources provided by Workday. So I have 3 links here on the screen. We will talk about the open enrollment checklist that Workday provides. We will talk about setup considerations and steps to manage your open enrollment. So I am quickly, yeah, Beth.
Natalie, I was going to say, these links are great to keep handy. These are the updated links with the way they've redesigned Community, so you shouldn't have issues with getting to them from the slide deck. And it's a place for you to reference the great checklists and guides that they have already available to you in Community.
Yeah, absolutely. Thanks, while I got these pulled up. So first up, we have our open enrollment checklist. This can be downloaded from Community. I have the link up over here. So it's it'll be actually under here in your Manage Open Enrollment. There is a link, and then we have the direct link to it. First up, I've pulled up the checklist and I've downloaded it. So this has your introduction, your open enrollment configuration updates, and then your testing and processing, and just some helpful things to go through. And then we have your integrations as well. Next up, we have setup considerations. So this is provided by Workday Community. It just gives you some use cases, some roles. If you have questions, it's very high level. And then we also have Manage Open Enrollment. So here's your link to your Open Enrollment checklist. You can get it directly from Manage Open Enrollment checklist too. And then just some steps. So that is a high level overview. So when you get this PowerPoint, you'll be able to dig in much more to those. We'll go back to our presentation. So next up, we're going to talk about benefits EIBs. So anything with the hyperlink to it, there is a sample on Workday Community. So those are linked when you get the PowerPoint. We have the healthcare rate EIB. We have the insurance rate, benefits annual rate, and individual rates EIB, and worker wellness data. So healthcare rates and insurance rates, you can actually download a template with your sample or what your current rates are now. You can change them and then re-upload them for easy conversion if you're using your calculated healthcare rates. So that is an easy win and an easy way to update those healthcare rates. If you use a bar or a benefits annual rate, you can update those via an EIB for a new value for open enrollment. And then if you are using individual rates EIBs, you can update those through an EIB. So you just fill out the EIB and then you upload it and you can check your data. And this is very simple and a quick win.
Yeah, when thinking about the EIBs, the ones that have the most fields to fill out in that wonderful template are going to be your rate EIBs. So the healthcare EIB and the put insurance rate EIB, which is why we recommend downloading those templates with populated data. Either updating your rates directly in the tenant and then downloading that template with the data pre-populated, ensuring your effective data is accurate, and using that to move those rates through to sandbox and or production when you're ready to go with those. The other option is download your existing rates and just mathematically update them within those spreadsheets. The put benefit annual rate and put worker wellness data along with the individual rate EIB are very simple EIBs. It's basically your employee ID, a couple of reference IDs, and the values for them. So they're not very complex or complicated to fill out at all.
Yeah, absolutely. And that healthcare rate and insurance rate, your main concern with those is making sure your effective date is right. So it's not too early or you're not using the current date, but you're using the date that you want those new rates to go into effect.
Exactly. All right, so recently with the release in the spring, Workday deprecated the benefit worklet for employees. If you have not configured the new worklet or the new benefit and pay hub for a view for your employees, hopefully you're using a custom created dashboard out there. There is no longer a benefit worklet that will help guide your employees to make their elections. We provided basically a screenshot here of a benefit and pay hub setup. We limited the items on the screen so that we could focus on what we wanted to address. You can put announcements up there regarding the open enrollment, so it's available ahead of time, along with potentially an announcement on your home page. What we would love to call out on this page is it does under the needs attention section, call out that benefit open enrollment for you to go ahead and enroll. And that square will update as you go through the open enrollment process, letting you know you've submitted it. It's easy to use here for correction. So that type of navigation activity for employees are not as difficult as they used to be with that old benefit worklet. So that's a fantastic improvement. Another item that's been rolled out already is benefit card programs. where we can create benefit cards for our providers, put some pictures on them, add some links, put some words in them, and those are actively available throughout the benefit processes and the benefit pages. So just wanted to call out those two new opportunities and great ways to add a little bit of color to your announcing of your open enrollment and your basic benefit workflow.
Thanks, Beth. That is a great overview of the Benefits and Pay Hub. Next, we're going to talk about how much work is this going to be. We all know that opening enrollment can be stressful, and we know that everybody has a little bit extra on their plate. So we'll talk about some higher level effort updates or some lower and some medium. So where do you guys fall into this high, medium, or low effort updates? Beth?
Absolutely. So when we're talking with our clients and working on planning the open enrollment, the level of effort, the testing necessary, we have some things that fall naturally into what is expected to be a higher effort update. One of those items that we would think about in regards to higher effort is the benefit suite redesign. With those, if you are looking to completely redesign the benefit offerings that you have, wanting to use plan mapping, change all of your providers, potentially change the way your benefit groups and your eligibility is structured, that is pretty much a wholesale change, almost of benefit builds within open enrollment. The amount of changes there require extensive testing, making sure all of your mappings work right. If you want to default in elections when employees go in and experience the new plan offerings, your announcements, your communication, all of that needs to be considered. And that's why that kind of falls into a higher effort level for open enrollment. Another item that we consider would be if you're having a merger or acquisition with open enrollment. With those considerations, it would be essentially if you're bringing on a new population into your benefits during open enrollment and with the open enrollment event. So things that need to be considered are security around what they can see and when they can see it, the ability to enroll in the activity for open enrollment and experience that event without doing other changes through year end, things of that nature. And so with that intricacy, the mergers and acquisitions, along with the potential for needing to launch their open enrollment at a different window time than your current population, all push that into a higher effort level. And then the last item is that first open enrollment since launch or a Launch Express go live. So Launch and Launch Express are Workday's ways of getting you onto the Workday platform with speed and agility of proven prior practices. Part of the process after you're live on Workday is making Workday your own. So if this is your first open enrollment since you have gone live, there may be a lot of opportunities to take advantage of that you really want to see to customize the experience for your workforce. And so those types of updates may also push it into a higher level of effort or more thought going into it. After we leave that higher effort level, we get more into a medium effort level of open enrollment. This would include, if you think about it, things like provider changes. So if you're going to be changing your provider from, say, Aetna to UHC, Lincoln Financial to Guardian, those types of wholesale changes usually get us into a medium effort. There's things to consider, such as whether we're going to require our workers to re-elect because there's new offerings, or whether we want to do some type of mapping for enrollment in a certain plan today would equal enrollment in this plan once you go live, unless you make a change. You also have to consider new integrations and the potential for new payroll setups. So a provider change definitely can push us into a medium effort. Introduction of supplemental plans is another item. Supplemental plans are things such as critical illness, hospital indemnity, accident, cancer. These plans in some places have some significant interplay, both with how they work with high deductible health plans, the cost associated with them, how the integration requires the information to be stored in Workday to be sent effectively to the provider, as well as potential evidence of insurability requirements. So some of those nitty-gritty details of those plans that sound like they're pretty easy to add, those critical illness, hospital indemnity, accident, cancer suite of plans can sometimes definitely get us into a medium effort level pretty quickly. Also, plans requiring some type of creative design solution. So thinking about tuition assistance plans, if they're involved and involve a number of things, particularly for higher educations. Charitable contribution, if there's a list of potential charitable contributions that your company supports, sometimes that type of plan design can get a little bit intricate. And if you're looking at introducing a vacation buy and sell plan through your benefit process, that can also have some cross implications with payroll that need some time to work out and ensure accuracy. We do, though, Natalie, have some things that may make us breathe a little bit easier when we're approaching open enrollment, right? Those lower effort levels?
We sure do. So if you're keeping the same provider but adding a new plan, that is a relatively low effort. So the most involved, if you're just adding a new plan for medical or dental and vision, that's a relatively easy plan to set up if you're using the same provider. The most involved when using the same provider but adding new plans is going to be your insurance provider change. So just saying, hey, we're creating new spouse plans, we're creating new new life and AD&D plans offering different options. Those can be some of the lower effort, but you can kind of get into your medium effort. But that's the most involved is the insurance. Next up is you're keeping all of your plans the same, but IRS limits change every year. So you're updating your rates and your limits for those FSAs, HSAs, or you're updating a benefit annual rate or a bar if you're using those in your configuration. They're very straightforward updates anticipated year over year. So we call this a very low effort. The next step is new or updated links, enrollment instructions, or your new custom validations. Custom validations are still relatively new in benefits, but they were released a couple of releases ago. Custom validations do require a bit more effort depending on the complexity of what you are trying to validate, but those can still be set up in a very low effort open enrollment. Updating your enrollment instructions. If you don't have them evergreen, you kind of have to update them year over year. You'll use that maintain enrollment instructions. It's pretty quick and easy to do that. If you have any new or updated links from your providers, you can update those in your enrollment instructions and some other places. So still very low effort to get those completed.
Awesome. All right. Well, hopefully that helped us think about what we have coming for open enrollment and the level of effort. Natalie, myself, and our team at ERPA that works on benefits have been digging into what enhancements Workday has recently given us to consider with open enrollment, as well as the possibilities to come. Safe Harbor applies with release 2 that's due to hit preview in August. Natalie, you want to talk about the ones that are already out there?
Yeah, absolutely. Thanks, Beth. So the reopen open enrollment business process was released with a past release. This can be tested now in preview and sandbox as you're reopening open enrollment and testing that process during your testing and your regression testing. When you're setting up your open enrollment, this is one key thing.
And Natalie, I can add in, I've recently configured this. It's super simple. It's creating the business process, doing the business process policy security. On your open enrollment event type configuration, there's a checkbox to say to allow it to be a reopenable event. And then you can set both the number of days after close where it will be allowed to be reopened, as well as the amount of time it's allowed to stay reopened. In the business process itself, you can even add an approval step so your employees can request their event be reopened, and you can decide whether you want to approve that request or not. So Workday's finally giving us a real silent period.
Yes, yes, they are. So we're very excited to help customers use this one this year. So this was a win for benefits, and we're excited to continue to use them. On a past slide, Beth talked about on the Benefits and Pay Hub, the program cards, and she had a little arrow pointing to them, showing up on the Benefits and Pay Hub. So that is available. You can create those program cards and they will be able to see them on the Benefits and Pay Hub. Custom validations, more of a low effort, but they are very exciting. Those custom validations can be used for, giving a soft alert for employees to say, hey, just a reminder, you're going to have to complete an EOI. So they're not just seeing it on the last page, but they can see it up front, and it's giving them an alert to see that. And then the next item is benefit credit exposures during event elections. So employees can now actually go in, and when they're in their event, they can see that credit. They're not seeing it at the end, but they're seeing it during the election process. So we were also very excited to see this one. Next up, we'll talk about 2024 R2 releases.
Yeah, and as always with 2020, with future releases, safe harbor applies. We don't know for sure that it's coming until it actually hits A, preview, and B, production. But we've got some things that we're pretty excited about. So Workday is looking into redesigning the view for benefit elections. Imagine now if you're an employee going in and you click into your current benefit elections, seeing a card display of what you're currently enrolled in instead of that chart grid that we're used to seeing. This is what it would look like to workers and non-benefit admin and benefit partner roles. The benefit administrators going in as benefit administrators and the benefit admins going in within that role concept would still see the grid line appearance for the current benefit election view on the worker profile. Workday has said they're going to be delivering this with an option to opt out of the card view if you're not ready to introduce that yet with your open enrollment. Another thing that's really kind of exciting, we haven't quite seen how it works, so we're really waiting with bated breath for the enhancements to hit preview, is they're enhancing our benefit messaging. So for a long time, you've been able to send notifications out off of the open enrollment status report based on employee statuses. Couldn't customize them really well, couldn't control them really well. Most people kind of shied away from that functionality for other options where they felt they had a little bit more control over the message or who it was going to. Workday is supposed to, again, that safe harbor, supply us with the Workday notification designer for that functionality with release 2. So imagine you being able to use templates and things like that, similar to the kind of notification designer that you experience when you're doing notifications on a business process. So we're really excited to check that out once it hits the streets. Hoping it hits the streets. And hopefully you all are excited about that possibility too. It's an opportunity to perhaps move away from an external messaging system and use Workday delivered options for that as well. And then those credits that Natalie talked about before that have now been beautifully exposed within the events so that employees can see their credit right there and not have to dig into the statement to find it. They're also making benefit credit offsets available for additional benefit plans for the first time. So we're looking forward to that possibility with R2 as well. And just another call out, it will be in preview on the Friday before the week of August 19th is the expected delivery date. And so we're all super excited to check out what's coming and how much of that we're able to use to make a really exciting open enrollment period this year.
Beth, I know what I'm doing on August 19th. I'm very excited.
You and me both, girl. Maybe even the 18th or 17th. Just saying, I might not be able to stay out of it over the weekend. I'm guilty. All right. So It's not just benefits with open enrollment, although if you're a benefit person, you know that's the most important department in the world. There are other teams to consider. So Natalie, what do we need to think about when we're trying to plan for open enrollment, particularly cross-functionally and with a timeline?
Yeah, absolutely. So our ideal timeline and benefits is we actually do a backwards timeline. So we think about the first payroll of the new year. And then we go back and say, when in Sandbox can we start payroll testing those new limits out? And then we go back and say, when do we need to integration test? When does our vendor need our first production file? Then we take a step back and say, when can we payroll test our current year rates and limits? When are they ending? And then when do the new ones start with our new paycheck? So working through those and testing those. And then when are we going to have our open enrollment? So what's our end date? What's our start date? So if we need to reopen open enrollment, we need to have that period. But give ourselves enough time to review the data to get those integration files ready. So we're kind of backing up. Our ideal start date is November 4th. If we're going for it. The next one is, when are we updating production? So we're going to test in preview and we're going to test in Sandbox, but when are we going to have everything in production so that it can actually copy down to Sandbox? So if anything pops up as an issue in production, we can still test that in Sandbox. So when are our dates that we can do that?
Yeah, we actually get a dress rehearsal in benefits. It's wonderful.
Yes, that's our favorite part sometimes. The next up is Sandbox testing the week of the production week. The next one is refresh to production. So again, when do we need that configuration in? When are we going to move from production to from Sandbox to production? When are we going to move from preview to Sandbox? So just backing into those dates. And then the real question is, when are you going to have all of your new benefit plan offerings, new rates? When are you going to have all that? So you've got to figure that into your timeline. But the great news is you can start open enrollment, you can start regression testing August 19th with safe harbor applies, all of the new rates. So yes, our timeline does start in 19 days. So it's very
You guys
exciting.
looking a little stressed down there, Natalie.
It can be stressful, but the more you can back into a timeline, starting with your first payroll of the new year, all the way back to August 19th when preview, and that R2 is out there, the better off you'll be, because you've got some breathing room in there to really test in preview, Sandbox, and production.
That's awesome.
Yeah. Do you want to talk about integrations?
Yeah, let's talk about integrations in this timeline. So if there are new providers, particularly, integrations testing is some of the most extensive testing that would go along with this timeline. One of the things we always recommend if you're talking to new providers, and we all know that the boots on the ground, the people doing the configuration, can't always immediately talk to those new providers. You're under some constraints about contracts being signed and the provider assigning an implementation team and things of that nature. So we know these timelines can get very compressed with open enrollment. One of the most important things to talk to your provider about is your mitigation options. So most providers will take a manual uploaded file for initial open enrollment files. It's always good to look at that option and consider it so that you have it in your back pocket in case integration testing does not go quite so smoothly. It'll help everybody breathe a little bit better come November. With that in mind, on those new integrations, you got to pick the new provider, right? Sometimes that takes a minute. Contracts have to be signed. Provider needs to assign an integration team. You need to get connections set up and tested. Sometimes that can take a minute. Then you're looking at also sending the test files to the provider. They usually want an initial one, maybe 1 to 2 stage changes test files as well. They're going to want to give final sign off as well as you are that things are ready to go before they will promote and you can promote to production. So you're not working on your own timeline within your own organization. You're also dependent on that provider, their level of responsiveness when you get the final sign off and things like that, which is always why we recommend those front-loaded conversations about manual mitigation if the automated integration is not ready to go. Most providers are looking for those automated integrations if you have a 1/1 open enrollment the first week of December to ensure that cards can be mailed in a timely manner. So it's just something to keep in mind. All right. Now that we've got through our timeline a little bit, Natalie, I think the next thing we're kind of zooming in on here is cross-functional testing. So let's think about how we intertwine the integrations and payroll to make this one beautiful coordinated dance.
One coordinated dance it does need to be. Takes a little practice in both previews, sandbox. We're testing everywhere.
Yep, that's it. So we have an order that we recommend for testing open enrollment from the benefits perspective. If we're looking at it, the first thing we want to make sure is accurate is your new plan offerings, your eligibility. Can they make the elections they need to be able to make? Are your defaults working correctly? Is your event rule set up right for evidence of insurability? How is your benefit plan mapping going? Once those items are tested within open enrollment, the rates, you can review them later if you don't have them at the time that you have the rest of the configuration ready to go and test. 99% of the time, rate updates are dynamic. You wouldn't even have to reinitiate the open enrollment test cycle in your non-production tenant to see those updated rates as soon as you're able to put in the effective dated update into the tenant. We know sometimes those rates come in a little bit late. With that in mind, after open enrollment feels and looks really good and you're confident with that, we've got some other things that happen around open enrollment that's within benefits. So unfortunately, nobody's been able to freeze time between the open enrollment launch window and January 1st yet. Nobody's passed a law saying you can't have any changes in your life. None of that. We would love for the life in the world to stop for that time frame. Unfortunately, we don't have that option. So Workday gives us some tools and tricks. There's coordination of benefits out there. If you're familiar with the system and how that works in general, there's interplay with that with open enrollment. Open enrollment typically is when you are making a future dated election the furthest out in your benefit configuration. And so with that, you have a lot of things that can happen after those elections are made. Initiate open enrollment, close and finalize it, and then launch some life events that would take effect before 1/1 and watch what happens with the open enrollment reprocessing and going back to the employee to incorporate those life changes with the elections they made and give them another opportunity to make sure there's no further updates for that future benefit date. Another really big thing other than life events to test here is new hires. If you have delays on your new hire events in particular, you want to make sure you're comfortable with how those flow into open enrollment as well. So that's pretty much it for benefits. If you're adding new coverage types, you want to test all of your life events into the following year to make sure you carried that new coverage type across appropriately into all your events and that your event rules are configured for your new year so you're not broken on January 2nd to make sure that that's working accurately as well. So
And
that's the
please
benefit
don't.
perspective. Go ahead.
Yeah, and one other call out for benefits is don't forget to update your enrollment event rule. That is a key piece of information if you're adding a new coverage type. So don't forget your enrollment event rules.
Most definitely. And then we
Next.
kind of connect the payroll, right, Nat?
Yeah, let's talk about payroll. We recommend testing the last payroll of the current year when you're doing your testing. So we want you to test your old rates. And then we want you to test your first payroll of the new year that includes your new rates. So what is your delay? Do you start it on the first day of the new year? And that first paycheck is always going to get those new rates. Do you delay a little bit? So just making sure you're running more than one payroll cycle to get both your old rates and your new rates to make sure they are transitioning at the right time for you. And we know how employees love to look at their paychecks as of the first of the year. So we want to make sure that we are getting all of those points and making sure the paycheck is correct. And then
Yep,
next up, we'll talk about
absolutely.
integrations.
Yeah. One comment on the payroll that can be a little bit taxing as well is you are probably going to have to advance payrolls to hit those final payrolls in the current year and the first payrolls in the next year. The reality is you need to make sure those are accurate and you have enough response time prior to those payrolls being run in production. So a lot of the
Yes.
time that payroll end of year testing, unless there's significant changes, you need to ensure that all of the components work with, like changing your HSA employer contribution or something along those lines. You pretty much are waiting until end of November to test the final paychecks in December or beginning of December, so you're not having to advance as many. And then you naturally go into the following one after that. So there is the potential to lag that testing behind a little bit to allow those payrolls to catch up without having to advance your payrolls too far. Integrations. We talked about integrations testing. Integrations migrations tend to lag other migrations because there's additional testing that's needed. So if you don't have an implementation tenant and you're working between your preview tenant, sandbox, and production for your open enrollment project and prep, implementation will typically start in preview. The sooner you can get your open enrollment testing in a good place where you have probably about a 90% confidence level, 95% confidence level with it, you can move into sandbox for testing and do a sandbox hold. Essentially, when you are able to get out of the preview tenant, integrations can then control the preview tenant. Keep the data elections static. Make sure they're staged correctly for whatever staged requirements might be there with new providers and give them the time to get that feedback and have new events staged. So as you're moving your benefit configuration through, integrations can more own that preview tenant. With open enrollment, it's a beautiful thing. We can move configuration into production ahead of time, turned off. So we can make all our updates in production and not introduce the new benefit plan year, which means none of those benefits are live until that new plan year starts. So that's one of the things we tend to leave out of our production configuration initially so that we can get that configuration into production and then from there continually test upon sandbox refreshes, tweaks to that production configuration to have the highest confidence level possible in what is in production and what we're going live with. So integrations, a lot of times you'll see that testing wrapping up more around the November timeline with your fingers crossed, sometimes with delays that can't be helped. It can potentially bleed into the next year. The most fervent hope is the timing allows for it not to, and your partnership with that new provider keeps things flowing to get those executed and in place as quickly as possible.
Yeah, Beth, you had talked about the refreshing back to Sandbox. I kicked off open enrollment on the customer side 2 weeks after we went live. So I was saved by being able to copy down to production or production copy down to Sandbox more than 1 week. I will say that is a true win because you can work out so many kinks that you didn't know about and you're still learning about. So it's a great opportunity.
Yeah, exactly. I agree. The more practice runs I have off of production configuration makes me happy when I'm talking with clients about scheduling. I'm like, okay, how fast do we think we might be able to move to Sandbox and how many refreshes does that give us? You know, do we have a session for blocking the performance versus a sound check versus our full costume with a small audience open enrollment ahead of the public? It is the
Yeah,
time of year that the spotlight's on us, isn't it, Nat?
it is. It sure is. So Well, we want to thank you all for joining us today. I'm going to turn it back
Yeah.
over to Jeff for any questions that have come through while we've been presenting.
Yeah, thank you. Yeah, we have had a couple of questions come in. Before I get to those, though, we mentioned the release coming up, and I know it's top of mind for everyone. So in the chat, and I'll give you a little guidance here. In the upper right-hand corner of your webinar interface, there's a couple of chat bubbles. If you click on that, it's going to take you to a chat that I entered that includes a link to the registration page for our own ERPA hosted release webinar, where we're going to preview dozens of the upcoming important releases coming up. So please, a dozen of you have already found that. So go ahead and click on that link. It will not take you away from this webinar. It'll simply open up a new page, and you can quickly fill out that registration form to be registered for that upcoming release webinar, where we're going to be prepared to answer a lot of your questions there. So 2 slides earlier, Natalie and Beth, there was a timeline slide with a chicken or a duck. I don't know which one it is, but he has a thought bubble, and it's an ideal timeline slide. And the thought bubble says this timeline starts in 19 days. So I had one question that came in that said, are you saying that all Workday customers must begin this process on August 19th? Can you clarify what you mean by this timeline starts in 19 days?
Go ahead, Nat.
Our ideal timeline starts in 19 days. From Beth and I's perspective, we have created that timeline to say, hey, this is our date that we want to kick off open enrollment, and this is the date that our new rates start. So that's the date that we have chosen to say that's when we want to start and go for it and get started with our testing, open enrollment, just kicking it off, testing that new reopen enrollment business process, but also the new features that will be kicked off with R2 Safe Harbor applying. But
Yeah.
we want to
So
test those as soon as possible.
we're super stoked about getting in there the minute that the release hits the streets in preview, so we can see and dig in as fast as possible and gather anything we can do to make open enrollment even better year over year. So we kind of geek on it a little bit. If you have the availability to get into preview, and you can always just initiate an open enrollment. You don't need a new plan year. You can initiate an open enrollment for 9/1 and check out what potential bling is there. Check out that notifications if it hits. Again, Safe Harbor applies to everything. So part of this is getting in there to see what ended up being delivered into preview and how it works. We don't get any advanced peaks any more than you guys do with preview and the releases. We get super excited about the fall release because of the timing with open enrollment. So that's more of a regression functionality. How quick can we start that? In all honesty, a lot of times Workday will release R2 back towards the beginning of August. When we saw the mid-August release date, we were kind of like, huh, that long? But that would be our perspective, and that's more along the lines of regression testing and seeing what Workday's produced. Now, the rest of the timeline, we know that benefits usually is not in control of that. It's typically your brokers or your executive committees or your boards that give you final approvals. So the bigger amount of changes you're expecting, the more you would want to front load testing. You can do it with configuration that has blanks just to see how different things may work and happen. The fewer changes you anticipate for open enrollment, maybe it's not worth doing rate change. You don't have rate changes, and that's what's changing this year, and you're probably going to get them on October 5th. Hey, maybe check it out, see if there's any link enhancement, enrollment instruction type thing to do ahead of time. And then once you get those rates in, you could start at that point. So the 19th is pretty much the earliest starting date with the new R2 release information.
Falls into the ideal timeline discussion. Okay, I do have a few more questions, and we only have a couple of minutes, so let's do some quick hits. Do you recommend using Workday to communicate open enrollment to employees, or how do other customers communicate open enrollment, the open enrollment kickoff?
I think if we get the notification designer, the updated messaging from Workday, it will be very awesome to use that going forward. I have seen a lot of customers do it outside of the system using their email, just quick hits to get them at the top of their mind and not just in their Workday inbox.
You can use preloaded announcements on the homepage saying Workday Open Enrollment is coming. You could also potentially use Alert Framework within Workday to give a more targeted message to your population that will receive open enrollment.
Okay. Another question, will the benefit program cards only show up during open enrollment or in the benefits and pay hub year round?
So those will show up in the Benefits and Pay Hub year round. If you're enrolled, they show in the Benefits and Pay Hub. They also, in that first screen after you hit the Let's Get Started for open enrollment, take up that blank page really nicely to give preloaded information within your benefit events as well. So there's a couple different places those do appear. If you go to benefit program card in community, it details pretty well how those are placed out there.
Okay, questions are piling in. Is there a way to customize the enrollment instructions, the panel to the right of each plan, to differ by plan?
Not yet.
Okay, that was a quick, easy answer. Next one, we are new to Workday and all our plans are set up and tested by Workday. In addition, have started going to the marketplace to negotiate either a plan change and possibly rate changes. Will we still need to do testing if we only do a rate change?
I would say you would want to, at a minimum, test your rates to make sure you're comfortable with the fact that you haven't set a frequency bad, like you said it is biweekly and the frequency of the rate is monthly, those types of things.
Couple more questions. This is great. We love it. We're going to stay on as long as you still have questions. So if people need to drop and go on with their workday, that's perfectly fine. But we'll stay on as long as you continue to populate questions within reason. Is there a way to override an employee's selection of Workday notification emails?
You want me to take this one, Natalie?
Go for it.
There's actually an EIB where if you were to go out there, run some reports, you can pull down what the channels are people have, and you can reset those channels so that your new restricted channel and notification frequency, you can update everybody who's out there to be immediate by email and then restricted to immediate by email. So you can clean that up ahead of time and force it to be that immediate email notification delivery. It just takes a little bit of EIBs and reporting to check it out for you. So that would also be something that I would look to front load as much as possible for open enrollment.
They did add a little context to that question. They said that they've had a history of potentially employees setting their alerts to come only weekly. And so they needed to override those in order to get them out in a timely manner. That fits with your answer, right?
Absolutely. Yes.
And then a number of folks have asked if the presentation from today will be available. Absolutely. I'll get that information to you in just a second. I want to make sure I don't have any more questions coming in. Great engagement. And folks, this is just the beginning of a conversation. ERPA is always here to help. We're always here to answer questions. So you can reach out to any of us at any time, and we'd be happy to hop on a call or set up an email thread or whatever would be most helpful to you to not only survive, but to thrive with the possibilities of open enrollment. I think that's it, and we are at time. So again, I'm going to point everybody's attention to the chat. The chat has the link to the next webinar. Again, all things Workday Release 2024 R2. So we want you to join that webinar, and you can register for it right now, even before you leave this one, and we will be happy to greet you there and see you there. Thank you, Beth and Natalie. Such a great job. Thanks to all of you who joined us today. We hope you found it helpful. And then this is a slide that tells you how you can get in touch with us here on the screen. And again, in a few business days, you're going to receive an email with links to the recording and the slides in answer to many of your questions. You're also going to get an email survey right after the conclusion of this webinar. We'd be grateful if you would take a moment to answer those 4 quick questions. And that's it for now. Thank you so much. Have a great rest of your day. And we have been delighted to share this information with you today.
Thanks so much.
Thanks all.